My name is Dr. Peter Krause. I'm a senior research scientist at the Yale School of Public Health. I've been doing tick-borne disease research for the past 25 years, and I've focused on four agents, or four infections: Lyme disease, Anaplasmosis, Babesiosis, and Borrelia miyamotoi, the last of which is a recently discovered infection of humans. It's sort of a cousin of Lyme disease. All of these infections are transmitted by the same deer tick, and people can sometimes be infected with more than one of these agents. We've now gotten into the 2017 summer tick-borne illness season, and by all accounts, the number of ticks is going to be fairly substantial this year. So there should be a fair amount of disease, unfortunately. It's certainly useful if you live in Connecticut, because most people in Connecticut are exposed to these diseases, to have some idea about them. Lyme disease is caused by a bacteria that the characteristic of which is or the clinical characteristic is a erythema migrans rash, which is a red rash that occurs at the site of the tick bite and expands to at least 2.5 inches in diameter and sometimes larger. And about 90% of people develop this rash that have Lyme disease. Another 10% who have about 10% who have Lyme disease will develop a viral-like illness. They won't have a rash, but they will develop a headache, fever, chills, sweats, muscle aches, joint aches. The diagnosis of Lyme disease is relatively straightforward if you have the rash. Most physicians will be able to diagnose or recognize that rash and treat. It's more difficult if there's a viral-like illness, and in that case, laboratory tests are needed. Anaplasmosis is a disease that's caused by a bacteria that infects white cells in the blood. Babesiosis is a disease that is caused by a parasite that infects red cells in the blood. And Borrelia miyamotoi is a bacteria somewhat similar to Lyme disease, as I mentioned, but that is found in the blood to a much greater extent, a more intense number of organisms, or a larger number of organisms that persist for longer in the blood. These three diseases, Anaplasmosis, Babesiosis, and Borrelia miyamotoi infection, all produce or cause a viral-like illness, and therefore laboratory testing is needed to make the specific diagnosis. Fortunately, these diseases, there's antibiotic therapy for all of these diseases, and this antibiotic therapy is generally quite effective. The treatment is generally 10 days to about 3 weeks, and as I say, in most people, the infection is cleared and symptoms clear, and the person does well after treatment. There are some people, though, who are immunocompromised or who have a delay in their treatment onset, and those folks may develop some complications or later manifestations, and especially with Lyme disease, where one can have joint, heart, or neurologic symptoms following the disease that may persist. The best approach to these diseases is avoiding areas where ticks are found, and they are found, of course, very high-risk areas are wooded areas where there's a lot of leaf litter. But of course, you can pick up these diseases often in your own yard. And so it makes sense to keep your lawn mowed and to get rid of any leaf litter. Some people also will spray their lawn, and that can be effective with an acaricide, an agent that will kill ticks. Also, if your house is next to a woods, building either stone or wood chip barrier between your house and the woods can be effective. Ticks don't like to cross that barrier, generally about 2 feet or so in length. In addition to these measures, one can use personal protective measures, and these include just obviously avoiding areas that are high risk, such as wooded areas, but also wearing long sleeve shirt, long pants, and tucking your pants into your socks. Also doing tick checks at the end of the day, and if you find a tick on you, removing it, it's best to do that with tweezers. Also, some people use tick repellents or acaricides that kill the ticks, which would include permethrin for clothing or DEET to apply directly to your skin. There's also the possibility of preventing Lyme disease by giving antibiotic prophylaxis after a tick bite. And this approach really is something that you should be discussing with your physician as to whether that makes sense or not, depending on the circumstances of the bite and other factors. And then finally, there are community measures, such as several of these, but probably the most effective would be reducing the number of deer. Deer cause an amplification in the number of ticks, and so if the deer herd is decreased in size, the number of ticks and the amount of tick-borne infection decreases. And this has been shown to occur or been shown to be successful in several areas, especially island areas, but even a mainland area have carried this out successfully.